Welcome to Confessions, Convictions, and Conversations, a podcast exploring the cool Christian girl's guide to living in America. I'm your girl, April Davenport. I'll reveal to you a little personal testimony while merging ministry, education, and real life. We will also discuss current events with relevant figures of our time. It is the perfect blend of headline news, black girl magic, and of course, Jesus juice. Come with me on a journey you won't soon forget. So stay tuned, don't change the channel, and let's take a ride. Welcome to Confessions, Convictions, and Conversations. I'm your host, April Davenport. Wow, what can I say? I am still on cloud nine from our podcast live last week as you helped me to celebrate my birthday. Thank you, thank you, thank you. I'm so excited for all of you who were able to share with me live. I'm so excited for all of you who were there streaming, and for those of you who went back and watched it. I am still on cloud nine. I'm so thankful to God for being able to celebrate my 40th fresh start, and who knows what the year will hold, but I will echo the sentiments of the podcast live. The best is truly yet to come, not just for me, but for all of you out there. So have a fresh start, not just today, but every single day that you wake up, and always remember that the best is yet to come. Today, I'm so excited to have with me on the podcast one of my friends, Dr. Kenyatta Stephens, as we discuss Free Your Body, Understanding Public Health in the Black Community. We know that there is so much conversation surrounding public health, and so we want to make sure that you are armed with all of the proper information so that you can make the best decisions regarding not only your personal health, but those regarding public health in not only your family but in the greater community. So, Dr. Kenyatta Stephens, it's great to have you on the show. Welcome.
Thank you, April. It is such an honor to sit before you and just to be able to discuss with your audience everything public health. So
I appreciate you coming on. So why don't you tell the people exactly what it is you do, what you study, and exactly explain your title and how you got into public health.
Okay, so I am currently an infectious disease epidemiologist by training. I do have previous experience in molecular biology and molecular genetics. I did research at Emory School of Medicine for about 8 years before transitioning into public health. And I have been in the public health space now for about 15 years. And I started out working in the lab, doing research, met an epidemiologist growing up in Decatur, East Side. I had never heard of an epidemiologist, and public health, really just in our community wasn't really a thing. It was teachers, lawyers, doctors, pharmacists, things like that, but nothing really in public health during the time that I grew up. And so got at Emory, working there, started doing cervical and breast cancer research. And with that, many of you know there's an HPV vaccine out. So started working with some clinical trials with the HPV vaccine. And that's how I got really introduced to the world of public health, met some epidemiologists, and I was like, hey, I think I can do this. And also, a lot of them didn't look like me, but they were in our community. So I was like, well, this needs to change, because there was like that hesitancy with some of the teens with, opening up and talking to them because they didn't look like them. So working at Emory, they were like, okay, well, you can go to school. So I started in their Master's of Public Health program. And then I transitioned to the PhD program. Didn't finish there because I started actually working at the CDC. So I moved to an online program and did a PhD in epidemiology. And so now you're wondering, like, okay, so what does an epidemiologist do?
Okay.
So I always say, because I talk to a lot of students and especially like my family, my older aunts and uncles, they're like, so what is it that you do? So like, and so it's like a disease detective. So because I've traveled the world setting up disease surveillance systems in developing countries, And I've worked several outbreaks like Ebola. I've worked on it's like MERS, Middle East respiratory syndrome. So I spent some time in all of those countries that end in Stan. And so it has been an eye-opening experience, going to villages in Africa, and even just being a Christian woman and having to go to places where they don't recognize Christianity. So that has been a challenge. And well, it was a challenge because I don't really travel globally anymore, not for work anyway. And so, yeah, I have been cursed by witch doctors,
Wow.
all kind of stuff, people throwing rocks at you. And so I got that questions from like my colleagues, and they're like, well, why aren't you scared or whatever? And just to bring like the Christian perspective, I was like, I don't fear anything that God created. So a rock can't curse me because it's not human. You know,
Right.
it has no life. And so those are the types of things that you really have to take with you when you're out in the field and doing this kind of work. And so so for example, I think the first outbreak that I worked was at Whitewater. And for those of you who are in Atlanta, you know what that is.
Yes.
So we got called because there were some people that were getting sick. So we had to trace it back to the source, which we realized was some kids who had basically pooped in the pool and gave everybody E. coli
Wow.
infection. So it's just like that, where you know there's a sickness going on, you don't know what caused it. So you have to go in and investigate, ask questions, know what the signs and symptoms are of different diseases, and just kind of go back. So that's why I said it's like being a disease detective.
Wow, I like the way that you explained that, and I think that really helps to give people some kind of basis and grounding, because many people think that with the outbreak of COVID, and we'll get to that in a moment, that public health and epidemiology, vaccinations, that many of these things kind of just took place. But as you definitely explained, of course, science has been around, right? Epidemiology has been around. The study of disease and infectious diseases has been around. So this is nothing new. But of course, this is just really, it's coming to the forefront for a lot of people because people have really kind of ignored the subject of public health. So why would you say that it's very important for people to be educated about the subject of public health, not just for their own personal health, but for the greater good?
April, that's really a good question. And I have been since the pandemic started, because Black people were like, this is a shock. This is something that we weren't prepared for. But this is not even our first pandemic,
Right.
because we've had the swine flu, Zika. Those were pandemics. They just didn't affect our society as worse as bad as COVID has been wreaking havoc. And so basically, public health is the pulse of the community. And we have put, especially in the Black community, we put so much emphasis on medical doctors and medicine. And we think that's where our health lies, and it doesn't. So public health is about intervention and it's about prevention. So we go out and we find out what's going on in the community, and we try to prevent it from happening. We try to intervene to keep diseases from spreading, whereas medical or clinical health is basically just treating. So
Mm.
after you've gotten sick, they're just treating. They're not going back out into the community with interventions or preventions. You get sick, you go to the doctor, they give you medicine for that illness at that time, but they're not tracing it back to your community to say like, hey, there's contaminated water, or there's lead or mold or something like that. So that's where public health comes into play. And when I say it's the pulse of the community in terms of the health status of the people in your community. So that's definitely one reason why it's very important.
Would you say then that there is a disconnect between public health and private medicine? Are the two not functioning together in order to make sure that the community is beating well. If you want to say that public health is the pulse, then you want to make sure then that if it's the body, right, if the greater body needs to function well, would you say that there's a divide between, and we know that some of that divide is economics, right, is money. There's a divide there. But would you say that there's a divide even in intention, maybe?
It's April, it's very broad because we all know that there's like a crisis with maternal morbidity and childhood mortality when it comes to even just giving birth for Black women. And
Right.
it's because there's a lack of understanding of culture. And so even with just regular treating of people, like I have a colleague that does medical transcription for doctors, and they're sitting there and they're listening to the conversation between the doctor and the patient. And if, there are certain colloquialisms and just, certain vernacular that's specific to the Black community that the average doctor wouldn't know. So when a patient is describing what happened or what's going on, the doctor, there's a very broad disconnect. And so even in that space, and because of that, now she's pursuing a public health degree because she says that there needs to be something that binds the two worlds together, because there is a divide right now. And not just with health, even with just treatments. And with the opioid epidemic, where that plagued the Black community forever, but it wasn't until, housewives of other persuasions started having issues with it. And then that's when it became an epidemic. But when it plagued the Black community, it was just, there's nothing wrong. They were withholding medications. It's just, it has deep roots into a lot of the socioeconomic disparities that's really running deep within the Black community veins.
So what do you think is, I mean, obviously there's no one answer, there's no solid answer, but how do you think you begin to remedy that those issues, and not even between the structural systems, but even just with the community? How do you begin to disperse the knowledge that public health is so important? Because what's happening in our school systems, right, with our children, how do we begin to raise up children that are more knowledgeable about public health, that understand even epidemiology, so they're not like getting to college and having to wait to see someone like you to understand that, one, this is a field of study, that, this is a possibility for something that you to go in. Because I tell my students all the time, like there are definitely more than 5 careers, right? There are 1,000 of careers that you can go in. With, public health certainly being one of those fields. But so what would you suggest as something, maybe 1 or 2 remedies that we can go into to help educate our people more about the field of public health?
Just letting them know that there's something other than STEM. So we need to really start introducing public health into the school system as early as elementary school. When you think about water supply, like how are you getting your water? What happens when water is contaminated? I'm working with a group now that's creating kits to give to students to test their water at home, and then they can send it in. And then that way you're still collecting that information. And if you don't have good water, which we've seen in other countries, because that's what, in America, we always say, oh, it's the other countries and their public health and they need our help. No, it's the same right here.
Right.
on our soil, because we think about Flint still doesn't have clean water.
Right. Exactly. That's sad.
So, and it's not just Flint, it's some of the poor states like Mississippi, where they have contaminated water supplies because of the rivers and how all of that interconnects. And just start early teaching our children about what health is. And it's more than just going to the doctor for a checkup, and just to throw that, there's like mental health, emotional health, start teaching about financial health. It's just so many parts that go into your health other than going to the doctor. And I think that hasn't been stressed enough in our community.
I agree. So then, okay, so we have these three words, COVID-19, pandemic, virus, right? We know these words are forever etched into our history, into our memory banks. It's like, you can't even make it through the day without hearing these words. And for some people, you're cringing when you hear these words, depending upon what your experience has been with them, right? If you've lost someone, if you've suffered with the disease. So why do you believe, you've obviously mentioned some of these reasons, but why do you believe that our community was especially affected by the pandemic? And that's one question. And then the next question is, what do you think we can do to lessen the effects of, hopefully in our lifetime, we won't ever experience anything like this again. But what we do know is that we're technically still in this pandemic, right? It's not like it's over. So how can we begin to try to lessen the effects of the pandemic?
Those are really good questions. So the reason why our community, Black and Brown communities especially, were affected is because we didn't have optimal health going into the pandemic. So there was already like a lack of access to adequate care, disproportionate health care, lack of resources that had already plagued our communities in the beginning. So you had communities where high blood pressure was pretty much common, or heart disease, or diabetes, we know. Our kids, we have the highest numbers for type 1 diabetes. And so with that, when COVID came, because your body has to be at optimal health to fight COVID.
Right.
And that's why so many people, once they get it, they're succumbing to it rather quickly. It's aggressive. It attacks pretty much every organ now, multiple organ systems. And so if you are not at optimal health, you will have adverse, reactions to COVID. And that's putting it like politely, if you will. So, like I shared with my family, and thank God no one, in my immediate family has been plagued by COVID. I immediately told them these are some things you need to do. Like, you need to walk every day, increase your lung capacity, increase your vitamin D. Black people naturally have vitamin D deficiencies. 85% of the patients that died when they were autopsied had a vitamin D deficiency.
Wow.
So those are the things, but they're not being shared in our community.
Wow.
That type of knowledge. So every platform that I've had the opportunity to be on, that's the one thing. You have to make sure you're getting your vitamin D, zinc, and of course you can always go to your doctor and get your levels checked, but it won't hurt you to take an over-the-counter supplement.
Okay.
And just exercising. We all had a lot of downtime at the beginning. Some people gained the COVID-19 and more. So, but you have to get to a place of optimal health. And that for the Black community has been our challenge, because we don't even know what that looks like anymore. And it's different for each individual. But right now, the best thing that you can do for yourself during this pandemic, and to be able to fight off COVID, if by some bad chance that you are exposed to it, is to have your body at optimal health, so that when you're exposed, you can fight it. And that's why you see like the differences. Some people get a mild form. They may only lose their sense of taste or their smell. Others are, it's more aggressive, where they're having to go to the hospital and get oxygen, especially if, and other thing that I forgot to mention, asthma. If you have asthma or any type of respiratory disease, it's going to be harder for you, because we all know when COVID was first introduced, to the US, it was basically attacking our respiratory system or our lungs. So think about asthma with Black community and with our kids. It's like we had red dots on us, like as a target. So we really have to make sure that we are doing some type of activity just to increase our lung capacity, and that's number one.
Right. I think that that's, some things you mentioned are very accurate, because many people don't know what's happening inside of their bodies. I think that, you have a lot of people in our community who don't make it a priority to stay on top of their own health. They don't maybe, get regular exams, physical examinations. They don't go to the doctor regularly. And even still, being in tune with your own body is one thing. And, you mentioned about the lung capacity. I think that's very, very important. And I know, one person who, in my family who's very close, she really, really got sick, and it's still having some adverse effects because of it. And the lung capacity is why, because she was really having a lot of difficulty breathing it, and still is. And her doctor mentioned her about the walking and trying to really strengthen her lungs. And that's something that, like, you can't just look at yourself in the mirror and see what your lung capacity is, but I definitely agree with that. And so now, obviously we have the vaccinations out. And so it's like, now we're fighting another battle, because we're trying to educate our people about the pandemic and the virus and public health. And then now we're also trying to educate our people about vaccinations. And so, it's like there's constant battles happening in our community. And some of it is because I think there's so much misinformation out there. And it's like, we don't hold on to the good information, we hold on to the misinformation, and we will ride that for so very long.
Absolutely.
And so it's frustrating, because what happens is that we have this misinformation, and then people make decisions based off of misinformation, and some of those decisions can be very costly. So before we get into the specifics of the COVID-19 vaccine, just let's talk about vaccinations, period. All right. And, just help our people understand what a vaccination is and what it does and how it can benefit, our community, public health, and how it can benefit, especially in this case.
Okay. So we've all been vaccinated, because now, your kids can't go to school unless they have like their shots, or those are vaccines. And so, and so there was also just some confusion between immunizations and vaccines, because people didn't realize they were essentially the same.
Right.
So even just the language of public health has been an issue in our community, because you can stand before them, or they can go and sit in front of someone and they can have these conversations, but unless they understand the vocabulary and actually what's being said, then there's another disconnect there. Right. So immunizations, vaccines, basically the same thing. So vaccinations work by introducing a part of the virus into your body so that your immune system can recognize it and create antibodies to fight it if it's ever seen again. So that's my simple explanation, because when, I've seen people talking about, the T cell, the B cell, people, they don't know what that is. So, some vaccines give you inactivated forms of the virus. There are certain flu shots that do that. So that, because that's the only way that your body is able to recognize it. And so it's not an active, except one year a couple of years ago, when they put the flu vaccine out, they forgot to kill some of the virus and some of the bacteria.
It was dormant, right? Yeah.
I will say that. So
it's not God, it is science.
It's science. So yeah, so essentially that's what it is. So it's almost like, once you learn when something smells bad, you're training your body to say, okay, if I open this milk, I know what spoiled milk smells like. And so essentially that's kind of what an immune response is, training your body to recognize bad things or specific viruses and then create an immune response.
Okay, I like that simplified version. I think people can
Yeah.
understand that.
And I always, and that's my other disclaimer, April. I was like, if someone is sitting before you and they can't explain something to you where they're supposed to be a subject matter expert in terms that you can't understand, then run, because something's wrong.
Okay, I like that. Yeah, and I think that's what the issue is, that you have so many people who are looking for an explanation when they already don't, when there's already mistrust. You
Mm-hmm.
need to be able to create trust, and the best way that you can do that is with understanding. And so, you have so many people who may or may not have the opportunity as of right now, but the people who do have an opportunity, you definitely want them to be able to have as much education as possible to make a sound decision. And what you don't want people to do is to make decisions based on misinformation and wrong information. And so, another thing that we hear so much in our community is, people quoting the Tuskegee Experiment, the Tuskegee Experiment. And so let's talk about it's Black History Month. Let's talk about the Tuskegee Experiment. And so tell our people what is, since you explained the vaccination in such a simplified way, just explain what the Tuskegee Experiment is and why it is different from getting a vaccination for COVID-19.
Yes. So, and it's funny because, April, I'm also an adjunct professor of public health. I teach and a master's in public health programs at 2 universities. And so this is something that my students, because the majority of them are not minorities, that they needed to know and understand. Some of them didn't even bother about completing it. But that's another story.
Right.
And so, so the Tuskegee experiment started like right after the Great Depression, like it was 1930, like 1930, 31, around there. And so basically, some researchers got together and they wanted to do an experiment just to see how syphilis essentially ravaged the body. Because, with syphilis, you can get blindness, you essentially die. So they found, and it was done at Tuskegee University. So for those, which is a HBCU, so, let's not just blame one, okay?
Exactly.
And so, so they recruited these men and told them that they would get like burial plots and like these other things, because keep in mind, Great Depression, and they're already minorities in the time. And so what they did not tell them is that they were going to be basically followed for, I think it was supposed to be for like 4 months, ended up being some years.
Right.
And even after penicillin came out and as a treatment, they still didn't treat them. So they didn't give the men syphilis.
They had it already. Right.
They already had syphilis. What they did was not give them basically informed consent about the true nature of what they were studying, and that, there were serious outcomes as a result of not receiving treatment.
Right.
So
totally different.
So that's the simplified version without getting into it, because the misconception in the Black community is that, they gave the Black men syphilis. No, that the Black men already had syphilis, people. So what they did, the unethical part, was that they basically didn't tell them their true intent for the study, and they did not treat them when treatment was available. So that. Yeah.
Totally different from receiving
a
vaccine for a virus.
Yes, absolutely, totally different.
That has already killed 400,000 people.
Yes.
Totally different. And so we want our people to be educated with accurate information so that they can make sound decisions and proper decisions. Based on your research, based on your years of experience, do you see an end in sight this year? And I won't say an end, because we know, with something like this, especially as catastrophic as this has been, this will take some time. But do you see a horizon in sight this year?
Honestly, It's two part. So I did. So last year when I was telling people, like, I had started saying, like, y'all, if we don't do XYZ, we're not going to have a summer. And people were looking at me strange and all kinds of stuff when I'm like on these platforms. And so here we are. Now it's 2021. We're still in the same situation. So if you had asked me this, like maybe November, I would have said, yeah, by summer 2021, we would be in a better place. But now that we have all of these variants, and unfortunately, some of the vaccines aren't effective against these variants. So that may push us back some months, like maybe the end of the year, beginning of 2022. As far as like seeing, like starting to navigate in a, not a less stressful environment when it comes to spreading the virus, because we know that the UK strain is more virulent, and that means that it's more easily transmissible. Right. So whereas the original COVID-19, it was like maybe one person could infect up one person out of 8 people, one person will be infected. But with this, it's 1 out of 5. So if you are in a space and it's 5 people, at least one person has COVID. They're either asymptomatic or pre-symptomatic. And so that's just what that means. And I mean, and that's the reality of the situation. And people have COVID fatigue. There's also the misconception that once you get vaccinated, that you can't get COVID, and that's not true. You can be vaccinated and still get COVID. The COVID vaccines are only for you, to protect you. So if you are exposed to COVID and you get COVID, you will have the milder form of it. So you don't have to be hospitalized. So that takes some of the stress off of our already like burdened healthcare system. Yeah. So if you get vaccinated, you still have to wear a mask. You still have to social distance. And so it's no secret that there's a shortage of vaccines. There are supply chain issues. So for those who have been trying to get appointments, especially like the elderly population, just understand that it's not this, it is a bad system. They're working on and it's not just Georgia, it's nationwide with people trying to get appointments to get vaccinated. And then of course you have a group that feels like they need to be vaccinated that don't fall in any of the categories that are currently being vaccinated, just because of wealth.
Right.
So, and that has, as always, and that has really created additional vaccine hesitancy in the Black community and in the elderly population. So just understand that and my goal is not to persuade or dissuade you, but to give you the information so that you can make an educated or informed decision. And so if you know that you are not at optimal health and you have, some of these pre-existing conditions like asthma or diabetes or heart disease or high blood pressure, and you're not one of those people that decided to take charge of your health and get out and walk, then, you should definitely think about do the pros and cons for being vaccinated. And that's just the truth. And so I'm not trying to push anything. I don't have an agenda, but I want people to be well. And my goal is to make sure that our community receives the right information, that we have sources of information. And I always say, find your source of truth, because there are so many people out on social media, even the people on the news, y'all, that's scripted. A lot of that stuff is scripted.
And they have an agenda.
And but unfortunately, those are some of the only sources that our community have, because they don't know where to go or who to talk to. And now what you're gonna find is that you have, I've encountered, companies, non-minority companies that have gotten grants, COVID grants, and they are trying to go into the community to do XYZ with no experience.
Right.
So on the flip side of that, April, so we have, members of the Black community that, they're just the conspiracy theorists. They don't trust anything unless it comes, from a Black person. But then the flip side of that is that you have a group that don't believe anything Black people say, and they will take it from a non-Black person.
That's very true. That's very true. That's what I'm saying. We're fighting so many battles.
Yeah, it is so.
We're fighting so many battles, and like you said, where your priority is for people to just be well. I mean, and my goal is for people to be informed, so that they can make the decision, so they can be well. And I think, at the end of the day, we're both, wanting the same thing. But I definitely think that we all have a responsibility. I mean, I think we have a responsibility in our own health. And I think we have a responsibility for the greater good. So what would you say is something that we all can do, to ensure good public health for our community, not just in terms of the pandemic? Because what we don't want to do is to come out of this and then discard public health. I think that it's something that we all need to be conscious of, even after one day when the pandemic ends. What responsibility do we have to make sure that public health stays at the forefront of our minds?
Definitely educate our children so that if something like this happens in their lifetime, they'll be prepared. So it won't be another situation where our community is the most affected, but the last to get the information. And that's why I've been pushing since the pandemic started to get our communities like really just knowledgeable about what's going on, about what a vaccine is, about how, COVID works, and some of the things to look out for. So and just educating our children and talking about health. Y'all know, like in the Black community, it's so many secrets. Some things you don't find out until somebody's sick or someone dies, and you was like, oh, grandma had diabetes and she never told anybody. Right. So, like growing up, how you would have the family Bible with all the births and all the deaths. So start writing down health history.
Yeah.
Because so many people, I know, my friend was saying she took her mom, and this wasn't even like COVID related. And so she went with her mom to a doctor's appointment, and the doctor was like talking all this stuff. She was like, my mom doesn't have all of this. And they're looking at the record, like, yeah, she's been treated for X, Y, Z.
Wow.
And, the mom just never told the family that she was suffering. And then, Black women matriarchs, we are naturally like silent sufferers. Mm-hmm. So talk about health in the family. So, and particularly when, like I grew up in a single parent household, and I didn't know anything about my paternal side. So when I go to the doctor and they're asking questions, I have a whole side of my medical history that is unknown to me.
Right.
So I'm like, treat me for everything, check for everything, whatever, because I don't know. But if you do know, make sure, because a lot of times too, when we're going to the doctor, we pretty much only put down what we know on our maternal side.
True. And I think we also accept what's told to us instead of taking charge of our own bodies, our own health. And so I think that it's also one of the things you mentioned is, I think you have to do your research. I mean, and that doesn't mean just Google whatever and accept what Google says, but you have to do your own research and, look for credible sources, and use your resources out here. People like you, I think there are people like you, and then there are so many other people like you who are in our communities who have the knowledge. And if we look hard enough, we definitely can find them. So
absolutely. And always get a second opinion. You don't have to take the first thing that someone tells you. Mm-hmm. Because there's so many layers to our health. So, just like a friend of mine, young guy, he's like, I keep getting shingles. Like he got shingles like in January, and he was like, I got him so he got it last year the first time. And I was just like, well, that's uncommon. It's becoming more common in young people. Wow. Just because of stress, the level of stress that they have. But I said, so what about your diet? I was like, are you eating, like, what are some things that you're doing around Christmas time that you haven't been doing before, because your body is reacting.
Wow.
And so he was like, I gorge on seafood. Like he overindulges on seafood during Christmas. So last year was the first time he did it. January, he had a shingles outbreak. This Christmas, he did it. January, shingles outbreak. And I was like, okay, you need to increase this, decrease that, because seafood, some of, the minerals found in seafood actually will cause a shingles flare up.
Oh no, I didn't.
He didn't either. And he was like, and I was like, well, what did your doctor say? He was like, well, my doctor, he said, I went to the doctor and just told him I needed shingles medicine. And I was like, y'all didn't like try to
Investigate, right?
Because particularly if you're not overly stressed or, and you're relatively healthy. So our bodies are created to self-heal, but our bodies also let us know when we are indulging in things that we shouldn't too.
That's good. I mean, and I think it brings back full circle something that you said at the very beginning, in that one, that you were a disease detective, and that public health is doing the prevention, is doing the studying, and that and not to say that there's anything wrong with medicine. I'm not saying that at all. But it's kind of like there's one that's happening before, trying to get it before the disease happens, and then medicine is having to kind of do the cleanup work after the disease happens. And so what we don't understand is that there's a lot of there wouldn't be as much stress, there wouldn't be as much money if we could stop things before the disease happens. But once the disease happens, you do have stress, you have pain, you have loss, you have a lot of money on the backside that's involved in medicine. Both equally important. I'm not saying that at all. Both, medicine, public health are equally important, but we have begun in our society, we live in a capitalist society, to put a lot of stress on medicine. And I think that, it's equally crucial. And if the pandemic has taught us one thing for sure, that we begin to put more emphasis on public health so that we rise it to the same status as medicine.
Exactly. And April, every county has a community health needs assessment where they've taken the information from hospitals and said, and you can go by zip code, by city, or whatever, and they'll say, these are the health concerns for your community.
Right.
And that's a simple community health needs assessment in your city. That's a Google, and it'll pop up.
Okay.
And sometimes, during the pandemic, I doubt if they've updated it because it's crazy right now. But it tells you the health of your community. And if there's something on there that that's plaguing your specific neighborhood, or that there are certain people that in your church, in your community, that's suffering from something, and it's on that list, you can go and say, okay, how much money has been allotted for this? Because they get money for that.
Right.
But if the Black community, the Black, neighborhoods in these cities don't go in to advocate and request that some of that money be allocated to their specific neighborhoods, then it goes to the people who has the knowledge.
Wow, that's good information. And you know what else it makes me think about is that every county, every state, of course, has a state health department. And I think one of the other things, we talked about needing to change the